Hi guys, welcome back to my channel. My name is Khadija Adishola, and in my channel I talk about everything related to women and midwifery. So today I'm going to be talking about communication, and this particular aspect of communication is not just the general one, it's communication within the maternity department of the NHS, communication to the ladies, to the doctors, and to other midwives and other colleague. So if this looks like what you're interested in, kindly like, comment, share, and subscribe to my video. And don't forget to watch till the end because this is something that is relatable. And I can tell you, I'll also share my own experience as well in this video. Don't forget to share this video with your colleagues. If you are my returning subscriber, thank you for watching my videos always, and I really appreciate. So now, I'm going to tell you that one of the things I find as cultural shock for me coming to the UK is their communication process. So communication process or the ways of communicating to each other in the UK is kind of strange to me. And when I came to the UK, I realized this. And that is the first thing I realized. And I think it's very important for me to put these videos here, especially for because most of my viewers are from Nigeria, from Ghana, and there are people that actually looking forward to coming to the UK. So, as coming to the UK and as a midwife, you will need to really understand how they communicate within the maternity department. How you know, you need to really have a kind of competencies, yes, competency and in communication, yeah. You need to be able to relay information rightly, correctly to the ladies, to the doctor, and to your colleagues. So it's very important. One of the things I find out is that the way they actually use the terms they use, yes, basically, the terms they use are actually different from what we use back home. And if you don't understand these terms, it will be really difficult for you to communicate to the ladies and also to communicate to your colleagues as well. To your colleagues, they might really understand and take time to really realize what you are saying, but to the ladies, they might not be that patient enough to really understand you, and also it might not be easy for you to understand them as well. So one of the first thing I'm going to talk about is when you are talking to anybody in the UK, they tends to use more of passive sentences than active sentences. So they realize they can't you being rude if you use active sentences like do this for me, take this, bring that. When you use those sentences, they take it as you've been rude. For instance, you want to give someone something like, or you like, okay, take this machine to the store, take this machine to this place, take this blood to the lab, send this. Even if you are talking to the MCS, they take that as being rude, and when you say that to anyone, they will tell you that you are rude. So you need to really learn how to passively communicate to people here. So my example is, if you want to do anything, you have to say it in such a you want to do it, you are happy to do it if only the patient allow you to do it. For instance, if you want to check if you go to a patient now, you introduce yourself. Hi, my name is Khadija, and I'm one of the midwife that is going to be taking care, or I'm the midwife that is going to be taking care of you today. How are you feeling? And I'm here to listen to your baby's heartbeat if you're happy. Or can I listen to your baby's heartbeat? Are you happy for me to listen to your baby's heartbeat? Are you happy for me to listen to your baby? Are you happy to listen for me to listen to your baby and put you on this monitor, their health chart? And most of the time they will tell you yes, 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 yes. You can go ahead. Or when you say, ah, my name is Khadija and I'm the midwife that is going to be taking care of you today. I'm here to check your fetal heartbeat. They will tell you that you are rude. They won't say it to your face, but they will give you a report that you are rude. Or when you go to the patient bedside, hi, my name is Khadija and I'm the midwife that is going to be taking care of you today. I'm here to check your blood pressure. They'll say you are rude. You can say, okay, I'm here to check your blood pressure. If you're happy for me to do that, that's fine. You are not rude. So, you go to the patient, hi, my name is Khadija, and I'm the midwife that is going to be taking care of you today. So, I'm here to give you your medication, your pain medication, if you're happy for me to do that. Okay. Or are you happy for me to give you your pain medication now? Or, are you currently in any pain? Will you be needing any pain relief? Then you can say that. If want to serve a pain medication, most of the time in this place, you give pain medication in the maternity department. You give pain medication when the patient's need it. Most of the time, when the patient is in pain. So it is already most of the time pain reliefs are prescribed as PRN. So or regular, PRN or regular. So you serve pain medication when the patient is in pain. Most of the time, when the patient is pain, oh, are you currently in any pain? You say yes. Will you be needing pain relief? So you won't say, okay, because patients say they are feeling pain now, you go and bring pain relief. They might not take it. They might tell you that they don't want pain relief. They are feeling pain, but they don't want pain relief. So you need to be sure. And say, okay, you'll be needing, which pain relief you'll be needing? They know all of them. Do you need oral morph? Do you need codeine? Do you need Warren? All of them. They know all the pain relief. So you need to ask them. You need to gain consent for anything you are doing. That's the word. Yeah, gain consent. And when you want to get consent, you need to ask those questions passively. Yeah, you need to really, really ask those questions passively. And you need to be polite. That's the word. You need to be polite when you're communicating to them. Otherwise, and there are ways you talk and, you know, they will just see that you're rude. For instance, if you're lousy like I am, I'm kind of lousy person and I'm just talking and they will just say, you are shouting, you're rude, you're impatient. You don't raise your voice to anybody here, even if it's regardless, you don't raise your voice and they will just time you as being rude and they will time you as being, violent and all of that. So even if you're a kind of lousy person like I am, so you have to really, really learn to, calm down your voice. And I think the first thing I did when I came in and I just realized the way they do is to go for an emotional intelligence course, to do an emotional intelligence course. Yes. Because you really, really, really need to understand these things. Otherwise, everyone will just be telling you that you're rude. They might not say it to your face, but they keep giving this kind of review on you that you're rude. Even patients will say that. So you really, really need to learn how to communicate passively, to ask questions, to always otherwise what I just learned is if I do anything, I will just tell them, if you're happy for me to do that. So once you put that, if you're not happy, they will tell you, yeah, I've actually gone to a patient so that, okay, I'm here to give you your this and that if you're happy for me. And the patient was like, no, why am I taking it? Why do I need it? You need to be able to have, you know. Another thing I need to tell you that if you're going to serve any medication, please read about it. Not necessarily that you know it basically, like just read about it in case patient has questions. So I have this experience. I'm having a difficulty, issues. I'm unable to do something. So I called the senior midwife to come and help me with it, and she's doing it. So while she's doing it, I'm like, okay, and we have a lot of things to get done. So I was like, okay, what were you trying to do? So I go do that for you. And she was like, oh, I'm trying to serve this medication to this person. So if you're happy to do that, then I take the medication. And the medication, I don't really know what it is. And I was like, oh, let me just check this medication. So no, 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 she's not going to ask. She has been on it before. not knowing that that was the first day the medication was being prescribed. So when going to the patient, they're like, okay, I'm here to give you this medication, this tablet. And she was like, what is it for? No, like, this is the medication I don't even know. I've not seen before. I was like, have you been on it before? She said no. This is okay. I just bring it out. I can't even pronounce the name. I bring the medication out. So somebody. This is so medication. And she was like, "What is it all about?" I was like, I just have to say, "Oh, okay. You've been. I thought you've been on it before." And she said no. Okay, let me just check it. I just check online to say, okay, oh, they are like it was just an embarrassing moment. And one thing about this place is that they understand. They don't blame you for anything. That I don't know it. They even give me an excuse that okay, maybe you've forgotten about it, you know, none that about it. I browsed about it and I just tell her from what I read online. So there's you have to really read things here, and you have to know the way to communicate. When I said that, and she was like, oh, okay, I'm sorry, I don't know about it, that's what I'm asking, I just need to know. And I said, yes, it's fine. And that will not make her to see me tomorrow and feel that okay, think I'm an incompetent person. If it's in Nigeria, they will just give you that perception of oh, she doesn't know anything. Here, if you don't know, you can ask. Yes, you should ask. Anything you don't know, you ask. And when you are asking, you ask politely. So another thing I want to talk about is how you ask your ladies questions, especially for instance when you want to ask about anything relating to the to the vagina, to the perineum, to vulva and all of that. How do you ask that patient? For instance, me basically I would have asked, um how is your perineal wound, your your vagina perineal wound, your episiotomy site and all of that. How is it? How are you feeling there? But when I ask that question here, they will just be looking at me. What do you mean? What do you mean? So I found out that the way they communicate that here is that, are you feeling any pain down below? So they regard anything that has to do with vagina, doing, you know, examining the perineum and everything. So when you want to ask them, like, okay, can I have a look at your down below? They already know what you're saying. I bet if you say down below in Nigeria, they'll be like, what are you talking about? What is down below? So that is one of the things that I realize here. So if I want to ask a patient about their perineum and all of that, and say, okay, how do you feel down below? Any pain? What is your discharge and all of that? So, and also when you want to document that as well, there's a way you document PV bleeding, PV loss. Yes, they usually regard PV loss as PV bleeding. Yeah. So if the patient is not bleeding, they will say no PV loss, even if there will always be a discharge. So PV loss, it usually means PV bleeding, paravaginal bleeding. So that's how they put it out in there. So now another thing is that if you want to ask the patient if she has poo post cesarean section, and you just asking that, have you gone to the toilet? She'll be like, yes, I've gone to the toilet many times today. So you need to ask that, okay, is it that you do that? Have you opened your bowel yet? Or have you done number two? And the patient can even tell you, I've not done number two yet. I've not opened my bowel yet. So you don't. I was asking, have you gone to the toilet to poo? And they were like, what? What are you talking about? So that is it. Then another thing is, if you want to ask about the baby as well, you want to ask if the baby is pooing and peeing well, you just ask that, how many wet and dirty nappies do the baby, as the baby wet and dirty nappies, yeah, they put it that way. So wet means as baby pass urine, and dirty nappies means that the baby poo. So you need to really realize these things, and take note of all these words to be able to actively communicate within the maternity department of the NHS. There are lots and lots of it like that. So if you are a midwife that recently migrated to the UK, and you are in the maternity department as well, and you notice any of this, any other words that they use in communicating. Please say this in the comment section for other people to learn, and for me myself to learn as well, because I'm still learning about all of these, ways of communicating and all of that. So please, please, please say that in the comment section. And this is very important for us, because you, as a midwife, as an autonomous practitioner, you should be able to rightly document and, communicate your the care that you render to the patient, and also communicates to the, you know to um to your colleagues as well. For instance, another thing I noticed is that diarrhea and vomiting. If a patient is having diarrhea and vomiting, they will put it that D and V in communication in the notes that she's being admitted for D and V. Another thing is that, okay, folders now, I call folders, they call notes. So when you say folder, these other things that we use, underlay pad that we use in Nigeria, that we say, okay, underlay this and that, they call it inco sheet. Inco sheet here, I'll be like, what is inco sheet? I'll be like, get some. Okay, now, so I was attending to a patient and I needed that, it was, there was none, and I want to ask somebody, please, where did they put the underlay pad? And she was just, okay, where did they put underlay? Where we call it 90 gay again in Nigeria. Where did they put the 90 gay? She was just like, what do you mean? Okay, I was like, okay, that thing we put on the bed. And she was like, oh, inco sheet. So that thing, it took me like a while to realize that that is what they call inculture. So you need to really, really learn all of those things, and you pay attention to it. If you have not paid attention to it before, and that is why I'm making this video. Please, please pay attention to all of those things and all of those words that they use. Another thing I would like to talk about is those words as well, communication. I've talked about it, that it is passively. You don't say anything to any woman authoritatively, like you really, really want to do it. So you have to gain consent for anything you're doing, and you have to introduce yourself every time you go to the patient bedside. But for instance, if you have been attending to the patient since morning, then you might not really, really have to do a lot of very long introduction. But when you go in the morning, introduce yourself that, okay, hi, my name is Khadija, and I'm the midwife that's going to be taking care of you today. So that is that about that. So if there's any other thing that you learn or regarding the communication within the NHS, please, please say that in the comment section for us all to really, really learn about it. So thank you for watching my video, and see you in my next video. Thank you. Bye. Don't forget to let me come back. Don't forget to subscribe, like, and comment my video.